I was having chronic sinusitis. I was diagnosed with PCOS, irritable bowel syndrome, chronic fatigue, you name it. I cannot live like this. I don't know how people can manage the pain on a daily basis. Your kid's looking at you and you're just too tired to do anything. Once I got off the supplements that they were providing me, I still saw the weight loss. I still saw, significant improvement every time you put something in your mouth. You really got to be accountable for it. We really try to just simplify it for the patient. A lot of the issues that you're dealing with are probably related to what's in your cabinet right now. And they joined Revero for support because they're not seeing it from their primary care provider or any other specialist. I felt like I was being pushed to give them medication. You can see the wear and tear that they're having just because you feel like you keep hitting a brick wall as a provider. I feel fulfilled as a nurse practitioner working for Revero.
Hey folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up though, our spaces are filling up very quickly. We have with us Skye Thomas. Maybe you can just start with your background.
Thanks, Dr. Baker. I really appreciate you guys having me here today. So I started, my medical profession started, probably 2010 when I started nursing school for my undergrad and then graduated in 2014. From there, I went into acute care, adult acute care. Did that for about 2 years. Also did a little bit in the PACU as a PACU nurse, and then eventually went into telemedicine and working for a telemedicine ICU company where we monitored patients around the country. And very, very interesting cases that we got to see, that we got to be a part of. We also were we had our own nurse practitioners and medical providers with that tele-ICU medicine. And then eventually in 2017, I went and got my master's in public health. It was still a master's in nursing, but an emphasis in public health, and decided that I wasn't done. That I was going to go get my nurse practitioner degree. I needed more school apparently. And then around 2018 is when I started doing my journey into nurse practitioner for adult gerontology acute care. And then eventually graduated in 2021, right during COVID, when it was rampant. But yeah, now I'm working full time as a primary and palliative care nurse practitioner with a home health agency, and then working alongside Revero too, which has been wonderful. Completely different from what I'm doing on the primary and palliative care side for sure.
Yeah, it's an interesting background. And, as you probably know, having that, advanced practice, nursing degree allows you a degree of independence. So, I think maybe all 50 states allow individual, independent practice in that regard. So that really opens up a lot of doors for you to do it and to do stuff like this. That's one of the reasons we hire, nurse pracs in Revero, because we know they can practice, independent. I had a lot of time talking to a lot of PACU nurses over the years as an orthopedic surgeon. I was always, here's my, chatting with the PACU nurses because they were like, yeah, can we get some pain medicine or something? It was always one of those things.
Right.
But yeah, so, and were you like now Houston's the home of one of the largest medical complexes in the world. Texas Medical Center is just enormous. You got Baylor, you got Methodist, you got Herman, it's all the crazy stuff. So there's a ton of medicine that's going on in Houston. Were you part of that big giant thing, or were you always on the outskirts? Kind of, where did you sort of do your stuff, or where did you train? By the way, did you train down in the medical center?
I did. So I went to UT Health in Houston for my bachelor's in nursing, and then I went to, you're probably familiar with this, UTMB in Galveston for my nurse practitioner degree.
Yeah. I lived over there in Fish Village. I don't know if do you know, you're familiar with Fish Village?
Familiar with it, yeah.
Yeah, I had a house on 119 Barracuda with my old house. I remember that street. It got it got flooded by a big hurricane a few years later after we left, but it's still there. They just had, it probably got all I do mold renovation or something like that. So yeah, I used to be able to walk. It was like, it was like a 3-minute walk to the hospital because I spent a lot of hours walking back and forth at 4 o'clock in the morning to go start my shift, as a surgical resident. All right. So, you've been doing adult gerontology, which is, and there's a lot of, they have unique demands, some of these older folks, and some of them are polypharmacy. They're very frail. Many of them are at the end of their life. And so it's a different sort of emphasis, right? I mean, some of it's just comfort care, palliative care. And now with Revero, it's kind of a different approach, probably a lot different than what the traditional medicines you're used to is. We're like, let's get you off these medicines. Let's sort of treat the root cause. And so maybe what interested you and what drew you to want to work with the Revero team? Was it some sort of, I feel like I'm not as effective as I could be, or what was the draw?
Just personal experience. After going, or still on my keto diet journey, I wanted to do something with it. I wanted to bring my experience, bring my medical experience, and help patients that were struggling. And, working on the palliative care side, chronic care management, and patients that are on, their polypharmacy, right? And Revero just gave me that opportunity to be able to collaborate with other medical providers like physicians and other nurse practitioners, including the coaches. The coaches are fantastic with Revero, especially with their nutritional background. And I'm learning something from it. I'm getting something out of it too. And it's just making me a better provider for our patients.
How much, as an, I know this is a little bit of a rhetorical question, but, I don't think we in medicine in general put much emphasis on nutrition. I mean, obviously, somebody's in the hospital, you got to write them a diet. I wrote a diet every patient I admitted. So, you drop down menu. Do you want an 88 diet? Do you want a cardiac diet? Blah, blah, blah. But we don't really emphasize nutrition as it can help to heal disease. And you're probably experiencing, as someone who's seeing some of our Revero patients, is probably quite rewarding to say, hey, look, now I can get off my blood pressure meds, or I can get off my diabetes meds, or something along those lines. How much emphasis on nutrition did you see in the standard practice throughout your career? Obviously in the PACU, you're maybe not giving them any food,
Right.
so, throwing up on you, but
Right.
but obviously within gerontology, or you're working on it. If you're inpatient, you've got people that've got to eat. How much emphasis was given to nutrition?
Oh gosh, working in the ICU, we really relied on the nutritionist that was available, and we really didn't collaborate with them. That was really between the medical doctor or the nurse practitioner. And even, gosh, I wish nurses could have been part of that, because we would have gotten something especially to be an advocate for the patient, especially for patients that, have the history of diabetes or cardiovascular disease. And, hospital food, as you know, is not always the greatest. And even their options for a cardiac diet or a diabetic diet, it's not really up to par.
I mean, it's like pancakes with syrup and orange juice and some margarine,
Right.
because it's low fat, and then you got the sliding scale, and then you got to hit them with 4 units of insulin or whatever. I mean, it's just, I don't know if it ever struck you as, as somebody who was on a ketogenic diet at some point, saying maybe this really isn't the best thing to load these people up on cheap refined carbohydrates and then slam them with insulin every time they have to eat. I don't know. Did that thought ever cross your mind?
Oh, absolutely. Especially when I started working as a tele-ICU nurse and working during COVID and seeing patients that were my age, our mid-30s or even younger and severely obese. And when going through the charts and seeing that nutrition wasn't even hit, and there was no conversation about that. And then when we would camera into their room, they have this full spread of all kinds of refined carbs, refined sugars. And you feel paralyzed, especially as someone that's already practicing the keto diet and noticing the effects that it has on your own body and what it can do for a patient that is going through COVID or some type of inflammatory process, and being in the ICU and thinking, wow, there's so much more that we can do here, especially when it comes to pain management in the ICU too, right? Keeping inflammation down. And you just don't see enough, at least in the notes regarding the patient's diet plan. It really wasn't emphasized at all, unfortunately.
Yeah, and a lot of it's just you're just on autopilot with that.
Absolutely.
Did you ever have patients that were on ketogenic diets that wanted to do that while you were taking care of them? Was that something you ever saw?
Unfortunately, no. I didn't.
I thought the
I did
keto
not.
patients were taking up all the hospital beds, which you don't see in America.
They were at home. They were at home and being able
Yeah.
to relax and enjoy their keto meal, whether that be, or even carnivore meal, right?
Mm-hmm. Yeah.
A nice
Sure.
healthy steak, some butter.
So let me ask you, I mean, how long have you been on a ketogenic diet, by the way?
Oh gosh, since mid 2018. I think it was November 2018 when I started.
Okay. So nearly 7 years on this unsustainable diet that people say you can't do more than 3 months or something like that. And,
Right.
I think I first went on a ketogenic diet somewhere in the neighborhood of like 2012, something like that. It's 13 years ago, something like that. So, and I'm still on obviously a low carb diet, carnivore diet. So that's, we're often told that it's unsustainable. And, when you, I guess from a personal experience, what sort of benefits did it provide you?
So when I got approached about the keto diet, it was actually a family member that was part of a multi-level marketing program, and they were doing the keto diet along with their own supplementation, right? And just a bunch of vitamins and hundreds of dollars every month. And I was having chronic sinusitis. I was diagnosed with PCOS. I was diagnosed with irritable bowel syndrome, chronic fatigue, you name it, and early signs of gout. Mm-hmm. And I was like, I cannot live like this. I don't know how people can manage the pain on a daily basis, taking Tylenol and ibuprofen and rotating that. And then your kid's looking at you and you're just too tired to do anything. So I decided I'm going to go ahead and do it. So I did it for about 3 months with the multi-level marketing business. And after hundreds of dollars, I was like, I wonder if maybe the keto diet is really the key in this. Not so much on the supplementation, right? And this is before I jumped on YouTube. I was not an avid YouTube watcher, probably until COVID happened. And once I got off the supplements that they were providing me, I still saw the weight loss. Mm-hmm. I still saw, significant improvement in my hip pain. The gout was gone, the early signs of the gout was going away from my feet. The PCOS, I mean, if this is too much information, but my menstrual cycle was normal, which mm-hmm. was incredible because usually they were really heavy or just non-existent. And my energy just improved significantly. And then I noticed also my memory too, which improved. So I was just really interested when I came off the supplements and then the keto diet. And I was like, man, the nutritional side is so important. Every time you put something in your mouth, you really got to be accountable for it. And your mental wellness also plays in that too.
Yeah, one of the things, and it's interesting how you'll have people that will give pretty good dietary advice, but then will attach this sort of scammy supplement to it. To that's where they make their money, and you feel better because you switched your diet, and the supplements were just stuff that you didn't really need. And I see that strategy being employed all the time. You gain someone's trust by giving them good, generally good advice: get more sleep, exercise, eat a healthy diet. Oh, buy my supplements, and you feel better, but it's not the supplements; it's the other stuff. So,
Exactly.
Interesting to see that. So, let me ask you, with regard to now with Revero, one of the things that I'm very proud of is the fact that one, we have, physicians and nurse practitioners that are interested in, root cause treatment, that are interested in how nutrition plays a role and lifestyle plays a role. But the other thing that I think is really beneficial is the fact that these patients actually get supportive interactions very frequently, sometimes daily if they need it. And that's something that, as you know, I mean, particularly like, well, I can tell you as a clinician, in the office, I mean, you might see somebody, 30 minutes if you're lucky on a new visit, 15 on a follow-up, and
Right.
then you might see them once every 6 months. And there's a lot of things that happen within those 6 months that you never have
Absolutely.
access to, and you're relying on the patient's memory, whereas we are actually uploading data every day. So it's not depending on, well, what do you think happened over the last 6 months? Well, you know how people's memories are. They can't remember everything. Oh yeah, I forgot to tell you I had a stroke. Oh, that's relevant. It's kind of like, these things
I
that
went
are,
to the hospital.
yeah, these things kind of come into play. So it's nice to have that collaborative thing, like you mentioned, the coach. And I think our coaches are wonderful there with the coaching and the daily feedback. I mean, as a clinician, having that level of access, granular access to what's going on, did you feel, I mean, is it overwhelming to you, or do you feel that it's good that you have a better handle on what's going on?
Oh, one thing I feel is definitely supported by my colleagues, the physicians and nurse practitioners, the health coaches. We're all collaborating with each other, and it makes my job actually fun with Revero. Even though Revero is not my full-time job, I look forward to working whenever I get to work with a Revero patient. And our Revero patients, even majority of our new patients that come on to Revero, they're very knowledgeable, right? Some of them have been practicing carnivore diet or the keto diet for a couple of years now, and then been looking into more in depth in labs and supplementation and really trying to just hone in. And what's great about Revero is that we have, as providers and coaches, we really try to just simplify it for the patient for what they're presenting with us with, right? We're not trying to overwhelm them with a whole lot of information other than, just a nice plan that they can follow. And then they have us as providers and the coaches to fall back on as their support team. And it's incredible because on a daily basis, I'll get a notification, either in the chat or a patient's blood pressure reading or anything on the metrics that we're following for that particular patient. If it's out of the range or like a monthly update, I absolutely love it. It's really nice. And, to be able to find any type of job that you look forward to going to. I mean, Revero for me is definitely it.
Yeah, I got to tell you, it's fun medicine can be great and you can do wonderful things, but at the same time, it can really wear you down. And particularly, I see some specialties like, gosh, for instance, like neurology. I mean, it's just like your patients are all really sick and they never get better. That's got to be depressing. In the general context. Now, I've seen patients with MS that a neurologist would normally see, and they actually do get better when you switch their diet, which is really, really fun. And it does bring the fun back to medicine. A lot of us chose that especially because we thought we could actually help people to get better, to quote unquote, maybe even cure disease, which is not really talked about. I mean, the healthcare system now is really a disease management system. You're kind of just babysitting someone's disease, and it's just like medicate, symptom management,
Right.
adjust this med, add this med because this med has a side effect, and on and on and on. And so it is. And I remember I went down to Louisiana with one of our investors. He's an orthopedic surgeon that invested in Revero, and his practice, he kind of had veered off, and then he was a full-time orthopedic surgeon, but he also on the side was doing metabolic health in another separate clinic across town. And he was like, I remember when my surgeries used to get canceled, I would get kind of annoyed because I was like, oh man, I wanted to operate, and it's part of how you make your income. But he was like, if a surgery got canceled, he got excited because then he said, I'm going to go to my other clinic. And I actually look forward more to treating
Right.
people with diet than doing orthopedic surgery, which is kind of like, it seems unusual until you do it. And then I can tell you, it's just like, wow, this is so much fun when you see people get healthy like that. And as you point out, many of our providers do it part-time because it's one of those things where, they're not quite ready to leave completely because there's some stability there. But I think as Revero grows, um, I'm just wondering what your thoughts are. I mean, if as we take on more and more patients and the demand gets higher and higher, is that something you would say, like, I would rather do a little more time in Revero and a little less time in because it's more fun? I don't know. What are your thoughts on that?
Oh, absolutely. I don't get me wrong. I do love my older folks. I love working with them. They're great patients, especially when you have when you have a provider that's willing to listen and really willing to like sit down with you and go over medications. You know, that's why home health is fantastic in that aspect versus going to the clinic. But with Revero, because it's a journey that I'm already following and being able to walk with the patient and be able to help them along the way, along with the support that we have, I would much rather do that on a daily basis. Hands down.
Yeah.
Hands down. Hands down.
Has your experience with Revero bled into the stuff you're doing with gerontology? Like you say, hey, look, maybe you ought to try this with your nutrition. Have you tried it, or are you allowed to do that within the framework of what you're doing? Because obviously our whole setup is like, hey, we're going to talk about diet. We're going to talk about lifestyle. We're going to put that front and center. Whereas some places, I've seen some hospitals said, tell the nurses that you're not allowed to talk about diet. You can't talk. We have nutritionists for that. It's not in your purview. Therefore, you're not allowed to talk about it. What are your thoughts on that?
Yeah, unfortunately, with the primary and palliative care side, you kind of have to tread lightly with that. But I do still have that conversation with patients. I do ask them, what are you eating? And especially when I go into their home and they're showing me their cabinets and it's just full of refined sugar, refined carbs, processed foods up the wazoo. It just because I don't do that at my own home and going into someone else's home and going, a lot of the issues that you're dealing with are probably related to what's in your cabinet right now. And I just have a conversation with them and, give them the suggestion into looking into a low carb lifestyle, and letting them know that here are the benefits of a low carb lifestyle. And I try to make the patient accountable if they want to make that move and feel better without having to give them a prescription. Because that's the worst feeling, for me at least, is to prescribe a patient, especially an older folk, that we can really tackle it nutritional wise. And even with just a really good multivitamin, um, you know, electrolyte supplementation too, a good vitamin D, right? D3K2. I mean, just a base that they can go off of. And I do have that conversation with the patients. Again, I just try to be light with it and allow them, it's just a suggestion, just to take a look into it, do more research on their side and put that in their lap and see what they do with it.
Yeah, I guess once you see it, you can't unsee it. And, you see every day people getting better when they reduce ultra processed foods and they cut out refined carbohydrates and they eat more whole nutritious foods. It's almost miraculous in a way. And, people saying food is, and it really is. And we just, we've kind of lost sight of that because we've gotten so ultra specialized and dependent on labs and tests and, scans and studies and, all the drugs that are sometimes utilized for largely symptomatic management. Do you, do you work with a variety of coaches, or are you paired with the same coach all the time? How's your experience been?
Oh, variety of coaches.
And
It's kind of, it's always a nice little surprise who I get to work with. All of them are fantastic. Um, especially when you have a certain patient that's probably, because we as the provider typically have we have the onboarding call, right? So we're going to be the first ones to see them on camera, and then we look at their personalities, and it's interesting when they get matched up with the coach, and I'm like, okay, I think this would be a really good match for this patient with this particular coach. I've never had any issues at all with any of the coaches that are matched up with the patient, but it's just definitely interesting.
And you obviously you have a license in Texas. Is that where do you have licenses elsewhere? Or are you primarily in Texas right now?
I have licenses in 11 other states.
Oh, wow. Okay. Good for you.
So total of 12. And I'm trying to work on my Florida license along with my Tennessee license. I'm just trying, I'd like to do more with Revero, and that's really why I'm making that move. I'm trying to get more of my licenses active in different states.
Yeah, I mean, and it's good to hear from the providers saying that they're enjoying what they're doing, because I mean that makes for a better experience for both, obviously for yourself, but also for the patients. When a patient senses a physician's not enjoying what they're doing, it's just not a good experience. And so when the provider is liking what they do, I think they just provide better care, and I think that's an important thing. And then of course, when you're free to actually help people in a real sense. How often are you able to deprescribe medications from patients? Hey folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up though, our spaces are filling up very quickly.
Oh, absolutely. So especially when it comes to primary hypertension, that's the one that I see that comes off first. And it's so nice to see a patient's face when they're able to go, I don't have to take this anymore. And I'll tell you what, whenever we get like a notification from Revero saying the patient's blood pressure is low, and I get to make that call with that patient and say, you know what, it's time. It's time to let that go. And they're like, really? Are you sure? I'm like, your blood pressure is low. If we have it any lower, you're going to be on the floor. So it's time. It's time.
Yeah, and you bring up an important point, because we're collecting that data on a regular basis, sometimes daily, you're notified very quickly. And like I said, in a normal situation, you might be hanging out with low blood pressure and you not see the doctor for 3 months, and all of a sudden you have a problem with that. So we can react very rapidly to sort of make the right call. It says, hey, you don't need to be on that ACE inhibitor anymore, or that beta blocker, or whatever you might be on. I mean, there's multiple classes of antihypertensive drugs. It's like 6 or 7 of them, if I'm not mistaken, at this point.
Right.
Yeah. So that's got to be pretty fun. And then I guess how would you describe the patients in general that you get? What type of patients are you generally seeing?
So I see quite a few patients that are right around my age, between early 30s, mid 40s, men and women. And then I've seen a couple of older folks, in their 70s, and when they're coming onto our onboarding, some of them just blow me out of the water just because of how the lab work looks like it, because they've been following a carnivore diet before they've been on Revero first. And so to hear their story and to see that they've actually been able to get off medications before they joined Revero, and they joined Revero for support because they're not seeing it from their primary care provider or any other specialist, and they're seeking help. They're seeking, that support system with that medical background, that nutritional background. So I feel like it's a wide range, but probably majority is between 30 to 40-year-olds, men and women. And a lot of them really stressed out, honestly.
Yeah. Yeah. Well, the one thing, and obviously they come to us in some degree of illness most of the time, and then we're able to pretty reliably help them out so that they either come off medications or their disease improves significantly. Now, the sad part of Revero is because we're actually getting people healthy, we they don't need us anymore after a while. It's like,
Right.
6 months, 8 months, you're in, you're like, okay, well, you're good. We don't have any. And so it's a sad part because as a primary care physician, you might see patients over a course of 20 years or 30 years, their whole life. And now it's like, well, it's a different business model in the sense that because our plan isn't to keep people on meds for the rest of their life. It's to let's see if we can get you off this stuff. Let's see if we can really treat the root cause of the problem. What do you see being some of the more powerful interventions you do that help? I mean, are you focusing solely on diet, or do you talk a little bit about some of the other things, like other lifestyle things like sleep and activity and those types of things?
So a large emphasis is on nutrition, but the other side of that has to be their mental wellness. Patients, especially people my age, in their mid-30s, are having some significant stress just because of what's going on, right, in society. And they have their own families, they have their own gosh, it just sounds like their life is very stressful, and they don't have the tools or that support system that they need. And so it's really interesting because that's where the coach actually steps in, and with my assistance, of course, too, or one of the other providers' assistants, and we really try to devise a plan that not only nutritional but ways that they can do to relax. I'm big on decompressing at the end of the day. That's how I do it for myself. And, letting patients know that you have to actually spend some time on yourself, whether that's going into a quiet room, listening to sound baths, going outside, taking a walk, doing something for yourself for at least 30 minutes every day, whether that's the beginning of the day or in the evening, makes a significant improvement on patient stress level, just people in general.
Now, how do you integrate your Revero time with your other practice? Do you have a day a week set aside or something like that where you just do Revero, or do you have to do like a few hours in a day throughout the week? How do you prefer to do that?
Oh, Dr. Baker, I have to fine tune my time management. That's a huge part of it. So my the primary and palliative full-time position that I have, I work Monday through Friday, typically between 8 and 5. With Revero, I do try to squeeze in either the beginning of the day or in the late evening. And then on the weekends where we have our kids, I try not to work. And then the weekends that we don't have our children, that's when I try to make majority of my time towards Revero, just because I have time to do it and it works for me, it works for our work-life balance at home. And sometimes I have some time in between the day during the week where I'm not seeing a patient with my full-time job, and I'm able to, chat with a patient or even chat with the coaches that might have a question about a patient that's, kind of struggling or, just needed some type of game plan in place for them. So it's kind of a little bit all over the place, but I enjoy Revero so much that I really try to make Revero a good priority of my time in my work balance.
Yeah,
Work
and
schedule.
so as we scale up and we take on more and more patients, and all of a sudden the demand goes higher, maybe you'll say, like, look, I mean, what is your full-time job have the people that employ you, do they have any concerns? Are they okay with this? I guess they are. Maybe, I don't know. Maybe don't tell them. I don't know. Maybe I shouldn't ask you on live on the air here.
They know now. No, they never said anything to me about, if I ever had another part-time job, because it's the home health side. Our census, there's lows and there's highs. There's sometimes that we have patients that, we have a large discharge of patients because either they're hospice appropriate, or they have another primary care provider that they want them to follow. So It really, as long as they're okay with, as long as I'm available during their office hours. So I do make them a priority, and but I still love Revero.
Yeah. Gotcha.
I still
Gotcha.
love it. Can't get rid of it.
Yeah. Yeah. Well, I'm glad to hear that. Um, you know, and not, maybe hospice might not be the best analogy, but I mean, there's certainly people that are put in, like, you know, nursing homes that, or old,
Oh
you
yeah.
know, kind of end of life, not end of life, well, end of life, basically, you know, old folks homes, for lack of a better word for that, you know, the senior care living centers. And I
Right.
don't know how much you are on social media, but there's a fellow, his name is Hal Cramner, and he owns like 5 nursing homes in Phoenix, Arizona. And he puts his nursing home patients on keto carnivore diets. He has them exercising, getting out in the sunshine. And believe it or not, a
Really?
lot of those patients, like even the ones with early dementia, they become independent again. He literally, because a lot of these people that go to these, you know, these senior homes they're kind of dumped there, and just kind of caretake
Oh yeah.
till they pass away. And he actually gets these people healthy, and they want to go, but they come back home. The family's like, well, wait, mom's back, or something like that. Or dad isn't
Right.
crazy anymore. So it's really
Right.
interesting to see the impact that even at that level. And as you know, I mean, gosh, some of these older folks that are, you know, polypharmacy to the point of
Mm-hmm.
delirium. When you start pulling some of those meds off, they start to wake up. And then if you start feeding them well, and then start getting them a little bit of activity, you can reverse a lot of that stuff. And it's really a shame that we don't take more of an interest in doing that. And we just kind of like, well, you know, grandma's acting up, hit her with some Haldol, you know, get a little Ativan, you know,
Right.
it's like here, give her a little Ativan, you know, so she'll chill out.
Right.
So she's not such a problem. I say that jokingly, but it's a sad situation that you have that.
It is.
Yeah.
Absolutely. It is. Interesting enough, I had a, a patient that is in one of those unfortunate situations, and discussing with the family and letting them know, like, if we put more emphasis on what we're feeding him, you might see a difference in his temperament. You might not see the agitation, the anxiety, that goes alongside with dementia. And sure enough, the the family got on board and was like taking away all the sugary foods and trying to give him better options, at least fruits with a lower glycemic index, right? And
Mm-hmm.
not the processed chips that they were giving him during the day, like multiple times a day, just because they were trying to pacify him because he was just not having it. He was giving everyone attitude. So
Yeah, I was going to ask you, you know, if you know, just in your day to day, you know, full time job, if you ever see patients, you'd say, man, this person would be really great for Revero. Do you ever see those folks that you think might be appropriate? I mean, I don't know if your patients are all 90 and, you know, at end of life, maybe not, but I mean, do you feel that you see, I'm sure in your career, you've seen lots of patients that would be appropriate.
oh yeah, over across my career for sure. A lot of the patients, unfortunately, on my full time primary and palliative job, they're actually over 80 and
Mhm.
fall out of the ability to be able to do Revero. And a lot of them are actually not technology savvy. They really don't understand what FaceTime is or Zoom calls, and they're having to get assistance. And some of them just don't have that, financial capability either.
Mhm.
I wish we had the ability to give patients, especially that age, that chance and that support too.
Well, you know, maybe with time, you know, we'll see how things go as
Right.
we scale up, and maybe we'll be able to develop that capacity. Because yeah, you know, I think you can go to a nursing home, and instead of taking all the, you know, all the syrupy pancakes and cake that they feed them all day long, and just start feeding them, you know, whole foods, steak, eggs, maybe a few fruits and vegetables, and you would change probably the behavior, the awareness, the cognition, the fall risk. You know, I mean, I just, hopefully someone will be able to do that. I mean, we're digital, so we don't, it's not like we're it's not like we're a senior care living center, but we're making that change and showing what's possible. Um, let me ask you, when you went into nursing, back, 10, 15 years ago or whenever it was. Did you ever, what was your thought when you were going to, what you thought you were going to do and then what you ended up doing? Was it a very different thing?
Yes. So originally, before I had my son, I was like, because I was a pharmacy technician at the time, and I was like, I might go into pharmacy and working for one of the local pharmacies. I was like, I can't do retail. It's too hard, especially with so many patients on so many different medications. And I felt like I was being pushed to give them medications. I'm not the pharmacist, but just medications that didn't need to be necessary. Now that I'm a nurse. And so after I had my son, I told my mom, I was like, because my mom's a nurse, right? And I told her, I was like, well, if you could do it, I can certainly do it. I have all my undergrad credits, so I'm just going to go ahead and apply. And she's like, are you sure? I was like, I think so. We'll see what happens. And then sure enough, taking that journey and taking that leap into nursing school, and then eventually my master's degree, and with an emphasis in public health, and then eventually my NP degree. It's been an interesting ride, and I never thought before that I would ever go down this road, but I'm so glad that I have, because I feel like not only have I established something for myself, and I feel like I'm there for my family. I'm there for my patients. I can advise them, what better choices they can make, and at least make suggestions to them, and not watch them into walk into traffic type of situation, right? So
when you, how did you first hear about Revero, by the way?
When you were on Joe Rogan.
Okay. So there you go. Okay, let's go. Okay, yeah.
I'm watching you for the last couple of years.
Gotcha. Okay, got it. So anyway, well, good. I'm glad you joined us. I'm glad I made an impact. Tell me about, you said many of your patients are already somewhat savvy. Some of them have already been low carb. Do you get some that have not been there, and it's like for the first time, and they're coming from a standard junk diet? Have you seen too much of that?
Not really, surprisingly. I was expecting at first that we were going to have quite a few patients that weren't really familiar with the keto or the carnivore diet, but I've actually been blown out of the water with how many patients had started the carnivore diet about a year or 2 years ago, or even the keto diet, and how knowledgeable they've become. And what's interesting is seeing these patients at the point that they are with their diet, whether it's keto diet or the carnivore diet, and how much of improvement they have made, and where Revero can help them steer a little bit better by, really going into the macronutrients maybe that they need to focus on. Because there's been a couple times where we had a patient where they're just eating too much protein and too much fat. I mean, they're saying that they're eating till, they're satiated, but sometimes the lab work is, an indicator that maybe they're just going too far with it. And so we try to bring them back down and try to, really give them a game plan. And we try to keep it simple for them. We don't try to restrict them. We want them to enjoy their life. We want them to enjoy what they're eating, right? But with better options.
Yeah, and I think some of that, because most of our marketing up to this point, and people that follow me, for instance, because obviously I'm always talking up Revero because I believe so strongly in it. A lot of people already had some of that knowledge about keto, low carb, carnivore diets. But as our marketing campaign spreads out, and we're going to be reaching people that have never heard of this stuff or never done this stuff. So I think that'll be particularly fun, because you get somebody that's on a standard American diet that's hypertensive, diabetic, depressed, and then it's going to be miraculous. These people are going to be like, holy cow, what a big difference. So I think it's going to be even more rewarding as time goes by. So that'll be really fun. Now, the problem, I guess, is, really, how do you keep them on task and on target and compliant? And this is where I think the coaching and some of the features of the app and the constant feedback really help to do that. Because I talked to the engineers, and I said, guys, you've got to make this engaging. you've got to do whatever you can to help these people and make it as engaging, as user-friendly and gamified as possible so that these people actually enjoy getting healthy and it doesn't seem like a chore or a task. And so that'll be fun to see. What do you think is the hardest aspect of taking care of folks like this? Is there any things that you find are more challenging than others?
There's some patients where, like in particular, some patients that are actually joining Revero to actually gain muscle and gain weight.
Mm-hmm.
We're so used to patients that are they're wanting to lose weight, feel better, but there are some patients that are really struggling to actually put on weight, and that could be quite a challenge at times, because even when their lab work looks completely normal, like you don't see anything out of the reference range, you go, okay, so how? And that's a good way to get the coach involved too, and like how we can establish something for them nutritional wise, and what's happening outside of that. Is there stressors that are coming into that? Because patients don't realize that stress can be the driver of either gaining weight or losing weight, right? And we're always on the go. We forget to really come back to ourselves and really focus right up here.
Yeah, and that's one thing. Sometimes having a objective observer, because you have all this comparison data, you see what the other patients are doing. You get a sense, and you'll see this outlier, and they don't realize they're an outlier either in their lifestyle or something. And you're like, look, this might be contributing to X, Y, or Z condition, either negatively or positively. And so that's something that having an interested but objective observer say, look, I'm seeing this, and this is, and because you have so much data coming your way, you've got access to, just a tremendous amount of data the normal physician doesn't get. Normal physician gets, one blood pressure reading in December and one blood pressure reading in next June, and maybe the weight, and that's it. And then you've got daily things where you can see this, which is really a huge advantage, I think. Do you ever nerd out on the data? Do you ever like to say?
Of course.
Yeah.
Of course, because from my primary and palliative, I don't get that type of data, especially when patients are on so many different medications, whether that being on insulin, hypoglycemic medication, blood pressure medication, of course. I don't get to see on a daily basis what kind of effect it has on them. And having that data that Revero has, man, I can jump on there with a patient within minutes from when they put in their blood pressure. And I've actually done that. When a patient's blood pressure dropped too low, I wanted to check in. It's my acute care side, clicking on where I'm like, I got to make sure that they're okay, that they're alive, they haven't fallen, and of course, thankfully they were fine. They were like, yeah, I'm not having any symptoms. And I'm like, okay, that's when we have the discussion about, getting off the blood pressure medication. But anyways.
Yeah, and I want, because patients wouldn't be accustomed to that. It's like, wait a minute, the doctor called me and knew this right away, because normally in the normal system they would never know. They would not even if they, they would never know, so you'd never be contacted. So you're like, hey, look, I saw something that happened, an hour ago, and let's fix this right now, which is really, I think it's, anyway, I'm excited to talk to you. I'm, like I said, we spent a couple of years putting all this stuff together, and now it's finally coming to fruition. It's good to see that, some of the upsides that we're seeing, and certainly glad to see that you're enjoying it, because, I think that's a huge important part I think it's a two-way street. You got to have happy providers and physicians and clinicians just as much as you have successful, healthy patients. I think both those things have to work. So that's encouraging. I'm glad to hear it. Have you taught, we'll be continuing to hire as we expand, as we get bigger and bigger patients. Do you have any people, like any of your colleagues, that you say, hey, why don't you come work for Revero? Has that crossed your mind? Do you see anybody you think that would be like, equally interested?
Oh, absolutely. Absolutely. Especially with my primary and palliative job, because we do have like monthly conversations. We're a small practice of nurse practitioners and with our collaborating physician. And so we'll have a conversation every so often. And you can see the wear and tear that they're having just because you feel like you keep hitting a brick wall as a provider, that you're not progressing with these patients. They look like they're suffering. Every time you order a medication, it's not doing what it's supposed to be doing. And man, with Revero, it just has such a better positive outlook for it. And I think it was Rance that had a really good, he summed it up pretty well. When we see patients leave and graduate, I think that's a great term for it. When they leave and they graduate from us, then they get to spread the word of Revero. They get to let other patients know, hey, this is what worked for me. It's a support system. They're there to help you along your journey. And I mean, especially with our younger kids, they're more tech savvy with YouTube and Instagram. And I think Revero will see a different clientele eventually within the next few years as our younger kiddos are graduating high school and they're wanting to become healthy, and we'll probably see a difference. We'll probably see a change in our clientele, I think.
Yeah, Rance is he's really I like talking to him. He's a fun, happy guy. He's really positive and uplifting, and really, I think he's great for the patients. And that's something that I think, over the course of the coming years, I mean, I think there's going to be a lot of providers that see this as a better way to practice medicine, and hopefully someone will join us, and I'm sure there'll be, similar ventures being stood up at some point. But so it's wonderful. Well, I'll tell you what, Skye, we are almost out of time. So I want to thank you very much for doing this. If somebody wants to contact you in some other way, obviously sign up for Revero if they want to have you as their clinician. But what do you have, like a social media presence that you spend any time on that you want to share?
They can hit me up on Instagram. It's just Skye Kifer-Thomas. That's it.
All right. Skye, thank you for doing it. Thank you for being one of our wonderful, wonderful clinicians at Revero. And I hope we can get more patients so you can have more fun and help more people. Anyway.
Well, thank you, Dr. Baker. Thank you for making this possible. I feel fulfilled as a nurse practitioner working for Revero.
Well, I'm glad. And I'm glad for your patients as well, because they're getting better. Anyway, thanks, Skye. Take care now.
You too. Thanks so much.